In this lecture, we are going to discuss the antibiotics that are macrolides and the ketolides. Macrolides are basically the antibiotics which contain the macrocyclic lactone structure, and this structure is particularly attached to the sugar molecules which are the deoxy sugar molecules. So this figure is representing that we have this lactone, the larger ring, which is attached to the two sugar molecules or the deoxy sugars. Now, what are the examples or what are the drugs which are included under the category of the macrolides? These are erythromycin, azithromycin, roxithromycin, clarithromycin. So these are the drugs which are basically active against the respiratory tract infections, soft tissue infections, sexually transmitted infections, H. pylori, and atypical mycobacterial infections. Clarithromycin. Clarithromycin is a methylated form of erythromycin, and the azithromycin is the drug or the macrolide that contains the larger lactone ring. Now, coming towards the telithromycin, this is a semi-synthetic derivative of erythromycin, and it was the first ketolide which is now no longer available in the market because of its adverse effects. Now, coming towards the mode of action of these drugs, these are the drugs which binds irreversibly, not reversibly, irreversibly to the 50s ribosomal unit of the bacteria. And now what it will do after binding to this 50 unit, it will inhibit this translocation step. Now, other mode of action which are indicated or mentioned in the articles are that these are the drugs which can interfere with the transpeptidation step as well. Now, these drugs can be considered as bacteriostatic and bactericidal depending on the dose. The binding site is 50s ribosomal unit. As you remember, we have discussed that chloramphenicol also bind to the 50s ribosomal unit, but in case of these drugs, the binding site is different from clindamycin and the chloramphenicol. And the other difference is that these macrolides bind irreversibly to the 50s ribosomal unit, while the chloramphenicol binds reversibly with this 50s ribosomal unit. Now, coming towards the antibacterial spectrum of the drug, erythromycin. The erythromycin has the same antibacterial spectrum as was seen with the penicillin G, but one important thing that you should remember is that the patients who are allergic to the penicillin can use these drugs. Coming towards the clarithromycin, it has same activity as that of the erythromycin, and it is active against the Haemophilus influenza as well. Now, coming towards the azithromycin, it is less active against the streptococci and staphylococci as compared to erythromycin. So, coming towards the next action, it is more active against the respiratory infection due to H. influenza, Haemophilus influenza, and the Moraxilla. Now, coming towards the resistance, there are different modes of resistance that has been reported in this drug. The first one is that the decreased ability of the bacteria to take up the antibiotic, that is inability of the organism to take the antibiotic or the decreased permeability of the drug towards the bacteria. Second one is the presence of efflux pump. The pumps will efflux or throw out the drug from the bacteria. The third possibility is the decreased affinity of the 30s unit of the bacteria towards the drug, and in precise, this is because of the methylation of the adenine that is present in the 30s bacterial ribosome, especially in the gram-positive organisms. And the fourth mode is because of the esterases, especially esterases in the gram-negative organisms, for example, Enterobacteriaceae. Now, coming towards the adverse effects of the drug, the most common adverse effect that has been reported with these drugs is the gastric distress or mortality. Gastric upset is the most common adverse effect that has especially been reported with the erythromycin. Then second one is that at high doses, the drug has ability to cause the muscle contraction. That is, it can move your gastric content to the duodenum. So here is the diagram that is representing that GI disturbances. GI disturbances are the most common adverse effects. Then we have jaundice, autotoxicity, and T interval prolongation. That is, this there the drug has ability to cause arrhythmia. Now, the second is cholestatic jaundice. As I have discussed in the previous slide, that especially this is seen with the acylated form of the azithromycin. However, other formulations also shown this adverse effect. Now, the last is the autotoxicity. This autotoxicity is particularly associated with erythromycin and azithromycin. However, in case of azithromycin, it has been noticed that this is irreversible. That is, azithromycin is associated with irreversible sensorineural hearing loss.